Let's turn our attention to our panelists. I'd like to introduce both Dr. Myra Altman from Modern Health and Eric Gastfriend from Dynamic Care Health. Dr. Altman is the VP of Clinical Care at Modern Health, and Eric is the CEO of Dynamic Care. If you wouldn't mind, take a moment to introduce yourself, share a little bit about yourself and your company.
Yeah, absolutely. Well, great to be here, and thank you all for coming out for this panel. So my name is Dr. Myra Altman. I'm a licensed clinical psychologist, and I also head up the care team at Modern Health. So Modern Health is an employer benefits platform. We provide comprehensive mental health services. The way we think about it is a little bit different. We focus on both the clinical need, but also that subclinical need. So I've spent most of my time during the last year and a half thinking about how we address this really huge increase that we're seeing in demand for mental health services and increase in mental health symptoms. So how do we both really get people the care they needed when they're in that acute state, but also how do we change the conversation a little bit? I think when people think mental health, they think someone in crisis, someone in acute need, when really mental health is a full spectrum. And how do you provide preventive care for people up front so they don't progress into that clinical need zone, while also providing that care for folks who have a clinical need. So I think the pandemic has fundamentally changed how we think about mental health. There's sort of a divide. Some people are like, well, pandemic's gonna end at some point, things will go back to normal. I don't think that's the case with mental health. I think, if anything, we're gonna see things continue to increase. So I'm really excited we're having this conversation.
And Dr. Altman shared backstage that she is a hand talker, and yes, you are.
It's my Hungarian roots.
I love it. Eric, over to you. Please take a minute to introduce yourself to our audience here.
Thanks so much for having me. I'm Eric Gastfriend. I'm the CEO and founder of Dynamic Care Health. We are a digital therapeutic and coaching program for substance addictions, drugs, alcohol, and tobacco, combining remote substance testing through the app, using breath and saliva tests over selfie video, plus human coaching, coaches who are in recovery themselves, guiding them through the program, and a gamified rewards program. People can earn rewards for achieving their health goals, staying sober, quitting, moderating, and staying engaged in their program. And I started the company 5 years ago after seeing friends and family members going through addiction, rehab, relapse, and eventually recovery, and feeling frustrated with seems like how frequently treatment is unsuccessful, people going through rehab over and over again. And found out there are highly successful programs. I think a real bright spot is for physicians, physicians who have an addiction go through a physician health program that have 5-year success rates of 75 to 90%. And unfortunately, some of the best practices used there aren't always used in the rest of the addiction treatment system. So we started Dynamic Care Health to automate and deploy the best practices at scale. And this issue has only gotten worse due to COVID. There's about 20 to 30% increase in overdose rates last year, unfortunately. And this is something we're still struggling with now.
Excellent, thanks so much, Eric. And when David Gamble arrives, we're gonna take a minute to have him introduce himself and share a little bit about his firm. But in the meantime, we're gonna get started with the folks we have on stage. So buckle up and here we go. Eric, when we were preparing this, we were talking about statistics, and statistics, you know, our industry works on them. Statistics that make you go, wow, I didn't know that. And there was a few that Eric shared with me that I'm gonna read now. Members with drug or alcohol addiction cost $1,300 per member per month in excess costs above an average member. Did anyone in the crowd know that? $1,300 per member per month. And so back to what we do as insurance professionals managing costs, this is one of those areas that might be hidden in those claims. We already talked about 10% of full-time employees meeting the clinical criteria for drug and alcohol addiction often goes undiagnosed and untreated. And then Black and white Americans are roughly equally likely to use illicit drugs. Blacks are 2.6 times more likely to be arrested for it. And that was a bit of a shocker for me as well. So Eric, why don't you talk a little bit about your experience in the employer space, but also the other work that you've done. How do you see folks outside of the employer space looking at substance use disorder, and then specifically, as we've kind of done work with employers, how are they looking at substance use disorder in the workplace? Is it actively supported, passively supported? Does it differ by population and industry? So feel free to take us away.
Yeah, so there's a lot to unpack there. And one thing I want to mention in terms of the excess costs for each member with a drug or alcohol addiction, $1,300 per member per month. over the average member. That, addiction is a disease that's disproportionately young people. So it's even more shocking when you think about it that way. Unfortunately, in terms of the racial disparities with different groups being equally likely to use, but Black Americans being 2.5 times more likely to be arrested, really speaks to some of the injustice in our society around this issue. And there's been, a cultural shift, really, with the opioid epidemic, thinking of addiction as a criminal justice issue to more of a healthcare issue. And I think the country has made a lot of progress on that over the past 10 years or so. What I would like to see in the next 10 years is an additional shift from thinking of it as purely a disease under a disease model to also thinking it from a wellness perspective. How can we be more healthy by maybe reducing the amount that we drink, or marijuana, things like that. And that, I think, can really help to destigmatize this issue, which will make people more comfortable getting help and care for it. And I think the issue that employers have often is it's a sensitive subject, it's stigmatized, the employer doesn't really want to get involved. They're worried if they offer a benefit that the employees and members might not want to participate, think that it's, they're going to be monitored and that the employer is going to know if they're using or not, which of course isn't true because we have HIPAA and other patient privacy protections in place. But I think the mistake that employers make is if they're just leaving this to the health plan to kind of deal with this issue. The health plan may not be prioritizing this issue if that's not what the employer wants or is asking for. And also, the health plans are kind of constrained in what they can do about it because of what I call the tyranny of the billing codes, the CPT codes and HCPCS codes. If most health plans, most of the business is ASO, they're limited in how much they can innovate and change the treatment paradigms. And so there really needs to be a partnership between the employer and the health plan in order to create positive change in this space in terms of adopting and pushing out the best practices and also encouraging people to seek care. The employer has a closer relationship, better marketing channels to the members often than the health plan does. And so you can see a lot more adoption of healthy tools through that channel.
Eric, I want to ask about industries that you've seen that either have proportionally or disproportionately more substance use disorder challenges. But as a guy who never leaves the audience out of this, I want to look to the audience and feel free to shout it out. If you had to think of an industry or industries based upon either your own experience or just a hunch, any industry jump out, just shout it out, one that might have a higher use of substance use disorder or higher indications, feel free to shout it out. Healthcare? Hospitality? On my left side, anyone over here? Okay, tech? Manufacturing. Should we run through the whole list? Well, actually, that's kind of funny you say that. So Eric, enlighten us when you and I had a conversation about this months back. Help us understand where substance use disorder happens in the workplace, what industries.
Yeah. And I'll preface this by saying I think it's important to understand that substance use disorder affects all populations, all walks of life, all socioeconomic strata. But of course, we can look at the differences between different groups. So some of the industries with the highest rates of substance use disorder are, I think, hospitality was mentioned, restaurants, food services, manufacturing was mentioned, right. Construction, mining. Actually, healthcare is one of the lowest rates of substance use disorder. So I guess congratulations to those of us working in the healthcare industry, prioritizing our health in different ways. And it also varies regionally. Like smoking is more prevalent in certain areas of the country, like the South, less prevalent in the Northeast. But each different area of the country has different substances that it's struggling from. Where I'm from, Massachusetts, big problem with opioid epidemic. And in the Pacific Northwest, Washington State, huge problem with stimulants. So it really varies.
First of all, if we said DEI, you know what that is. What about DEIB? What does the B stand for? Anyone know? This was an educator for me when I talked to Dr. Allman, belonging. And belonging in the workplace and how you create a more welcoming workplace for your employees and how a broker and consultant's role is important in doing that is something we're going to be touching upon. So let's kind of help you hand off to David and talk through the tie between DEIB and mental health.
Yeah, absolutely. And I do think that belonging word is so important. I think we often think about sort of older ways of thinking about DEI is how do we be tolerant? How do we be tolerant of different groups? Who here wants to be tolerated? If your spouse tolerated you, would you feel good about that? Probably not, right? But that's how we've often thought about it. And so I think that's where the belonging piece has come in. Not just how do we have people feel tolerated or have numbers that we're hitting, but how do we actually create an environment where people feel like they belong? They are part of that community, they are integrated into that community, and that's, I think, the mental health component of DEIB. That's critical to whether someone can be themselves, can do their best work, is if they feel like they're in a place where they don't have to hide who they are and they feel like the entirety of them belongs. And I think that's why mental health and DEIB are really just so intimately connected. So I am thrilled that you made it to join us, David.
Yes,
I'm excited
glad to be here.
Learn more from you as well.
And David, please introduce yourself. You missed the introductions earlier, so take a minute to introduce yourself and your company to the crowd, and we'll dive into some of the questions.
All right. Well, thank you, Dave. Welcome, everybody. I'm David Gamble. I'm founder and CEO of DG Coaching and Consulting Services. It's an HR firm based out of Miami, Florida, completely remote, where we help small, medium-sized companies with their HR infrastructure, from recruiting all the way to training on all HR matters, including diversity and inclusion, which has been a real hot topic over the course of several years, but obviously escalated over the last 24 months.
We've seen in the past couple of years steps forward in the respect of diversity, equity, inclusion, steps back. A lot in the news, a lot, polarizing this, that, and the other thing. And it's been in the news and it's been in certain circles. I personally have not heard or seen it in the employer and benefits circle. So can you help us understand a little bit about what you're seeing in your role over the last 2 years or so as it relates to the hot topics that have been happening in society and what that's meaning for you as a service for employers?
Yeah, what has happened, Dave, and audience, is the fact that, what I call cultural events that are happening throughout the United States, whether it's George Floyd or other cultural events, it's creating a knee-jerk reaction to many organizations. Now they got to create a diversity team. Now we have to hire a diversity manager or director. And there's a lot of knee-jerk reactions, but they're still not really identifying the problem. So we caution in the fact that if an organization really wants to try and implement a diversity, equity, and inclusion strategy, is really trying to find out what's wrong with their organization. So we highly recommend an HR diagnostic to really figure out what's going on with that organization. Is it the recruiting? Is it the leadership? Is it not the employees not being heard? And Doctor talked about that a lot. If they're not felt of a belonging, then they're not going to give their discretionary effort. And if they're not going to give their discretionary effort, as you know, that is a huge retention area of opportunity. So there's a lot of moving parts. But as some of these cultural events force us to think and react, we recommend that we pause and really figure out what's going on in the organization and really embed it into the brand and into the strategy, and not have a brand strategy and then a diversity strategy, but having it part of that DNA.
When we kicked this off, we talked about the reasons why you need to know, and again, multiple reasons. The statistics that David shared, and I'll read them off now. Employees who feel their voices heard at work are nearly 5 times more likely to feel empowered to perform at their best. Employees who say their company provides equal opportunities are nearly 4 times more likely to say that they are proud to work for their company. And according to Glassdoor, 67% of job seekers said a diverse workforce is important when considering job offers. Keep that in mind as we struggle to recruit talent. And 57% of employees think their companies should be more diverse. So these are really important things that as we are coming, I'd love to say coming through COVID, it feels like we're still kind of pushing here, but we know that it's hard to recruit certain positions. David, talk to us about why employers really can't be waiting much longer to be putting these things in place. You said something that when Dr. Altman said the word tolerated, because of these events in society, folks felt compelled to do something. It was cause and effect. It wasn't proactive. It felt like, a toleration. We need to do this. Talk to us about why they can't wait any longer and they need to put this on the forefront of their planning.
Well, it's evident. The talent is shrinking, right? We're actually headed into the great resignation, right? Where talent gets an opportunity to have choices. They could either stay in your organization or they could look elsewhere. It's not like it was 10, 15, 20 years where somebody says, hey, I like this organization, I'm gonna stay and retire. They're really exercising their options. So organizations that wait, that pause, that are scared to engage in diversity, equity, inclusion strategy, they're the ones that are gonna be left behind. And as we all know, regardless of the industry, talent will always drive your business. And part of that statistic, it's around discretionary effort, right? It's not just about people wanting to get a paycheck. People can get a paycheck anywhere. But how, as a leader and as an organization, you could get that discretionary effort. You get that discretionary effort as an organization, that's where the innovation comes from. That's where the retention comes from. That's where the great ideas come from. So it's really important that organizations say, you know what, this is a fad, I don't need to jump on this, and you know what, I'll wait, even from political perspectives, I'll wait for the next 4 years. They can't have that philosophy. They have to have a philosophy of, I want to do the right thing for my organization because I care about each and every one of my employees, and collectively, we're going to grow our business.
Mm-hmm. Excellent. So we've kind of touched on some of the benefits of a DEIB strategy. Are there any risks or drawbacks to an employer, and how would you or how do you advise organizations approach this? Especially, let's start from square one. This is their first go around. They're going, you know what? Yes, we need to look at this. They don't know where to start. So how would you advise an organization get started? And are there risks or drawbacks to a culture of an organization that, frankly, might be fighting that a little bit?
Yeah, there's always a risk, right? The risk is if you do the wrong thing. And many organizations, that's what they're stalled because they don't want to do the wrong thing, right? So the risk could be, okay, we're going to hire somebody, or we're now going to hire, 10 African Americans in this department, and think that's the right thing to do. So there's always risk because it has to be a genuine process. It has to be a thoughtful process. And like I said earlier, it has to be a process that it's not a DE&I strategy. It's a strategy that's woven in to the company strategy. Mm-hmm. So it starts with the leadership. The leadership has to understand, where do we want to be, despite that my leadership group is all males, or all white males for that matter. Okay, not going to make the sudden change tomorrow, but what does 3 years look like? What does my succession planning look like? Mm-hmm. Am I asking the right questions? Am I quantifying and qualifying those potential leaders that make sense for my organization, or am I going to continue to do the same things that I've always done? So there's always a risk if you're doing the wrong things. That's why we do recommend, if this is something new for your organization, to get an outside consultant, have them generate the ideas that make sense for your organization. A lot of times, colleagues talk to each other. They talk to organizations they previously worked with that they have good relationships, and they say, we want to do what they did. And that may not be the best answer. The best answer is you need to do what's right for your organization and grow it organically and authentically. Your employees will know if this is not genuine, and that's where the risk is.
I want each of our panelists to kind of talk through a couple of, I would call it takeaways, things that they want all of you to take back, both to your own internal firms, as well as start to put this into practice with your employer clients. Because again, I hate to always make it about this, but as a former producer, I can tell you how I tried to get into accounts. It was, well, is your current broker consultant talking about this with you? And it's that fear of missing out. If you're not doing it and this other person is, you could lose that business. But let's put that aside and let's try to do it because it's the right thing to do, as David had said. So let's have Eric tee us off with kind of a couple of the key takeaways for dynamic care health related to substance use disorder.
Key takeaways, I would say addiction is a disease issue that affects all employers, 10% of full-time employees having substance use addiction. Usually it's under the radar. Around 80 to 90% of people with a diagnosable substance use disorder are not getting treatment.
Dr. Altman, your takeaways for the audience.
Well, I will echo everything Eric said. I think that applies to mental health as well. I think a couple of other things that I would think about. So one, right, this is not an issue that's going away. I think maybe we've all become a little bit more aware of mental health in the last year and a half than we have been before. Let's keep that awareness going. Let's not let that fade away because these problems will start to accumulate again. I think the other really big thing is, as I think about this a lot as a leader of an organization, I hope this is something that folks leave thinking about as well. If you're making a recommendation, or if you're thinking about something, or if you're evaluating a vendor, think about who does this solution solve for? Are there people being left out of this? And ask those questions. Like, I always get really excited when we're talking to people and they ask us, like, what is the diversity of your network? How do you assess for culturally centered care? How do you solve the needs for different people? Like, these are the questions I think we all need to start asking. And then that forces that change where everyone has to think about that. So we have to think about, are we building for everyone? Are we getting the same outcomes in different populations? Like, these are the questions I think we all need to have front of mind so that we push the field forward.
I love that. And think about what you help your employers build. These are benefit packages that impact the entire organization. How are you helping them build for the masses? And David, your key takeaways for our crowd today.
Yes, I think the number one key takeaway is around diversity is just not what you see. Diversity is just not black and white. You know, a lot of diverse, especially what I preach and try to teach, is around diversity of thought. And it's really powerful. It could move your organization. It could escalate and enhance your organization. So as you enter into diversity, equity, inclusion, and have a strategy, it impacts your bottom line. Bottom line in recruiting talent, bottom line in retaining talent, and bottom line in getting the most productivity out of your employees with giving discretionary effort.
I don't have enough education to be inclusive and to walk in the shoes of those people that truly are suffering from that. So what are we doing about that to help those of us to be more inclusive in our work environments that don't have the education that we need? So that would be my first question for anyone at the panel.
I love that, and I'll tee this up. As far as practical steps that could help, does anyone want to speak to that?
Yeah, I'm happy to address the mental health component of that. I think part of it is changing how we even think of mental health, right? So all of us have physical health, like hopefully we go to physicals, we go to our dental checkups. Like, how do we start to think of mental health in the same way? It's something that ebbs and flows. I don't know about you guys, but I had days during this pandemic where I was in the dumps and then I was back up again, right? Like, starting to acknowledge that that's part of the mental health experience, is that all of us actually do have an association with it. We do have a personal experience with mental health. One thing that tactically we've seen be really, really effective at the organizations we work with is start to model these conversations. So whether that's, a lot of the organizations we launch with, the CEO will get up and say, this is why we're bringing on modern health. This is my own personal journey, and maybe it's something that we would think about as sort of really mentally healthy. It's like, I run every day and I meditate and that's how I maintain my mental health. That's great. That's a great story to get out there to say, like, I'm thinking about it and I prioritize it. Or we've had organizations where someone says, hey, I've actually really struggled. I've struggled with suicidality in the past, or depression, or anxiety. And suddenly people start to see, oh, this is something that could impact a lot of people. Someone I know and work with and respect who's fantastic at their job has struggled. Like, then maybe it's okay for me to struggle and to raise my hand. We've had panels where employees share their stories. I think the more we talk about it, the more people see people who look like them, who have their experiences, say that this is something they've gone through. We start to normalize that a little bit. So those would be the things that come to mind for me.
Anyone else care to mention?
Yeah, I'll touch on that. Just from within the lens of diversity, equity, inclusion, what we teach is creating a safe environment. Right? Not reacting when, a social event happens and you as a supervisor now wants to, do I say anything? Do I not say anything? The George Floyd event did not really impact me. So how do I address that with maybe an African-American, employee of yours? So what we do is we call creating a safe environment, which would be one-on-ones, and really have a structured one-on-ones where it's not only talking about their performance for the week or for the month or what they're expected to do, but really talking about those, what I call having an uncomfortable conversation till it gets comfortable.
Do try to take one thing from each of these speakers back and actively take a look at it in your own organization first, and then as you're getting more comfortable with it, see if you can take it into your clients.